I am Professor Dr. Vivek Gupta, Senior Cardiologist, Delhi Apollo Hospital. Tomorrow is World Stroke Day, 29th October. Today we are standing here on 28th October. Stroke is a disabling disease. It is also not only disabling, but it can sometimes lead to sudden death, which is rare, not so common, but still. For example, I am a cardiologist. Heart attack, 50% patients do not reach hospital. While in a stroke, mostly the patient survives, but he has got a disabling paralysis, and paralysis is bad because if you have a right-sided paralysis, that the right hand is not working, then you are much more likely to have loss of speech, aphasia, and this lasts for the whole life, and this is very troublesome because then the whole family suffers. So what is the solution? The solution is that if you can diagnose stroke early means within 1 hour, within 2 hours, within 3 hours, within 4 hours, and you do a proper diagnosis and then proper treatment. Diagnosis here by CT scan and by clinical diagnosis. This is the crux. In cardiology, for example, I am a cardiologist. Heart attack is diagnosed by doing ECG, some blood tests by the HS troponin, and then of course we also do angiography and echocardiography. So when we have a patient of heart attack, that means our artery of the heart is blocked, leading to heart not functioning very well. Then we do emergency angiography and angioplasty. In this case of stroke, although we also can do thrombolysis, but in stroke, emergency carotid angiography and angioplasty is not so common, it's very complicated. But here what we do is, once you diagnose the stroke by CT scan, what you can do, the physician has to give thrombolytic therapy, which is TPA. And this is very useful because it can dissolve the clot, and most of the time the functioning of the brain comes back. The paralysis, the weakness of the limb or the lower limb or the upper limb comes back, and the patient's speech improves. And therefore you are preventing a very serious life-threatening condition. Dr. Vivek of Apollo on 20th October 2025. Please keep watching my YouTube. Thank you very much.